everyone, it's Joyce the dentist. One of the most common mistakes I see in my office is people choosing the wrong mouth rinse or thinking that their mouth rinse does something that it doesn't. One of the products that people usually use in addition to brushing, flossing, and tongue scraping is an antiseptic mouth rinse. So let's talk about them. Now, the fact that the mouth rinse is antiseptic means that it helps kill the bad germs inside of your mouth. It's not something you're using to necessarily freshen your breath, although that could be a helpful benefit of certain antiseptic mouth rinses. More on that a little later. The fact that it's antiseptic means that it's killing germs in your mouth when you're using it. In order for a mouth rinse to be antiseptic, it usually has something inside like an essential oil base or even alcohol concentration. Both of these ingredients help kill bad germs that are left over in your mouth after you brush and floss. Keep in mind that an antiseptic mouth rinse won't replace good oral hygiene. You have to physically get in there with the toothbrush and floss to get the plaque off your teeth and out from in between them. At that point, you use the mouth rinse to swish around and get any leftover or loose germs that are floating around out. But most importantly, the fact that it's antiseptic helps promote healthier gum tissues around your teeth. It's important that you understand antiseptic mouth rinses are not the same as fluoride rinses to strengthen or remineralize your teeth. Instead of for anti-cavity properties, they're used more for anti-gingivitis or anti-gum disease benefits. You use them to help promote better gum and tissue health, which in turn helps you to reduce your risk of gum disease and future tooth loss as long as they follow the recommended brushing and flossing every day. Because of the ingredients in certain types of antiseptic mouth rinses, some people may wonder whether or not these products are bad for you. And there's a lot of controversy around them these days. We're not just talking about alcohol-containing mouth rinses, which can increase your risk of dry mouth. I personally do not like mouth rinses that contain alcohol. Recently, there have been some studies out there showing that certain types of antiseptic mouth rinses can raise your blood pressure, which can be a major red flag for anyone who has heart disease or is already taking medication for blood pressure anyway. The good news is that not all types of antiseptic mouthwashes do this. In this particular study that I'm referencing, the mouthwash linked with high blood pressure or hypertension was a prescription strength mouth rinse containing the active ingredient chlorhexidine. Now, chlorhexidine is a really strong antiseptic agent that is used for multiple purposes, not just for mouth rinse. For example, your doctor or nurse might use a disinfecting agent containing chlorhexidine while preparing you for surgery to create a sterile environment. It's like wiping your stomach off right before a C-section. Some dentists will prescribe mouth rinse containing chlorhexidine if their patient has moderate to severe periodontal disease. When used as directed, this rinse helps to eradicate a lot of the bad bacteria causing your chronic gum inflammation and bleeding, so that your gum tissues heal better after treatment like a deep cleaning or periodontal therapy. Now, the controversy around this mouth rinse is that it actually eradicates both the good and the bad bacteria, which can pose as a problem for some people. However, chlorhexidine mouth rinse is not meant to use on a long-term basis. In most cases, your dentist only wants you to use it for about 2 weeks maximum. They might even tell you not to rinse with it. Instead, your dentist may want you to dip your toothbrush or cotton swab into the rinse and then place it on specific localized areas of your mouth. When used as directed, chlorhexidine mouth rinse can be extremely helpful for getting a grip on periodontal disease. Again, it's only for short-term purposes and doesn't replace the need for brushing and flossing. It's an add-on to give your smile a jumpstart for better oral health. When you consider the fact that gum diseases raise your risk of getting pneumonia, heart disease, diabetes, or infertility, you really want to do whatever you can to get rid of your oral infections. Since using prescription mouth rinse is temporary, there isn't as big of a risk for major blood pressure complications. That being said, it's extremely important that you communicate your health history with your dentist, including medications they're taking or past medical diagnoses, so they understand your risk factors. The biggest concern that I have for my patients using a chlorhexidine mouth rinse is that there's some staining that it causes. And if you rinse with this mouth rinse more than directed, it typically leads to heavy brown surface stains on your teeth that need to be polished off. Thankfully, this is just a temporary cosmetic concern rather than anything major. The good news for dental patients is that you're not going to see chlorhexidine in an over-the-counter antiseptic mouth rinse, so you don't have to worry about using one every single day if you have high blood pressure. Instead, some say it's good to look for mouth rinses that contain essential oils, which are a natural and effective way to help control plaque and gingivitis. Even the American Dental Association recommends using mouth rinses with essential oils such as eucalyptol, menthol, or thymol to help with gingivitis, plaque control, and circling back on the topic, even bad breath. These minty fresh oils serve a dual purpose. Personally, my favorite mouth rinse to use for anti-cavity protection is Elementa, which features nanosilver. My favorite for fighting bad breath is TheraBreath. I look for mouth rinses with an alkaline pH and without a lot of harsh, unnecessary ingredients. So ask your dentist which mouth rinse is their favorite. Now you can smile smarter and have healthier gums too. Here's another video for you to check out until I see you next time. Bye!